Some of the major developments we're tracking now: more than 3.4 million diagnosed COVID cases nationwide, with deaths here in the U.S. rising to more than 136,000, with more than 41 million here tested. With me now is ABC Chief Medical Correspondent Dr. Jen Ashton. Dr. Jen, on the minds of so many, will schools reopen in the next month or two? And with that, we are learning more about how this virus behaves in children. What have we learned?
Well, first of all, we have to start just with this unique location and population and talk about what we know thus far. First of all, in terms of environment, we know that viral infections spread very easily in densely crowded environments like most school settings, but there's limited published data about how SARS-CoV-2 actually behaves in this setting, and we need that information. We also know that the pediatric age group in general, 0 to 18, is at low risk for severe COVID-19. That does not mean zero risk. But we also know that the school staff, the teachers, the faculty, and the relatives of students are, just by definition of being older, at higher risk because of age, because they may have pre-existing medical conditions. So that's a factor. And just released, Amy, from the CDC, that masks absolutely help prevent the spread of this virus in closed settings. That's data that comes out of Missouri, hairstylists. So if they reopen, we would think that masks would be an integral part of that.
That's right. And even within this student age group, there is new data suggesting that different ages are affected differently by the virus.
Exactly, and that was just put out in the last couple of days. Interestingly, that younger children, so we're talking about 0 to 10, actually are not that susceptible to infection, although they can definitely spread it. Teenagers, let's say 10 to 20, much more likely to have been infected. And so we're thinking that children at different ages can absolutely have different immune reactions to this virus. Again, not one size fits all. And so the decision to reopen schools has to be based on what modifications can be made, whether hybrid systems can occur, whether that can occur remotely or in person or a combination. It really needs a tailored approach based on the age, based on the type of school, where it's located, and try to figure out some solutions.
Yeah, so what do we still have to learn? We don't have a lot of time.
Exactly. So one of the most important things that we don't know yet is what the role of testing will be in helping schools reopen, whether that's pooled testing or individual testing. We don't really know yet whether parents and teachers will feel safe and comfortable with the virus circulating as it is right now. We always have to balance the risks and the consequences of not reopening schools, because that list is significant. And I think really important, Amy, here is to ask the question, what is the end point? If it's just delaying till January, things may not look measurably better in January. They could, in fact, be a little worse. And so we have to figure out how to live with this virus.
All right, Dr. Jen, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.